Bismillahirrahmanirrahim. Today we will study the anatomy of gynaecoid pelvis. A gynaecoid pelvis is composed of two paired innominate bones, the right innominate bone and the left innominate bone. This is sacrum. This is coccyx. The innominate bones are formed by three separate bones, the ilium, ischium and pubis. The acetabulum, which is a socket for the head of the femur, is formed by the fusion of these three bones on each side laterally. When the acetabulum of pelvis articulates with the head of femur, it forms the hip joint. Demarcations of each bones can be seen in acetabular fossa. Posterior-inferiorly, we have a bone called ischium. Anterio-inferiorly, we have a bone called pubis. The superior part of acetabulum, acetabular roof, is formed by ilium. The parts of ilium include iliac crest. These are iliac fossa, which are also parts of iliac bone. This is anterior-superior iliac spine. This is anterio-inferior iliac spine. On the back side of ilium, we have posterior-superior iliac spine, and this is posterior-inferior iliac spine. This curved structure is called the greater sciatic notch. This is lesser sciatic notch. The parts of ischium include body of ischium. Ramus of ischium is another part of ischium. We have superior ischial ramus and inferior ischial ramus. This is ischial tuberosity. This is ischial spine. These yellow bones are the pubic bones on each side. Pubic bone also has two parts. First part is the body of pubic bone. Also in the pubic bones, we have superior pubic ramus and inferior pubic ramus. Inferior pubic ramus of the pubic bone unites with the ramus of ischium. This is sacrum. In sacrum, we have different parts. Like here you can see the sacral promontory. Here we have the sacral ala on both sides. These are the foramina for the passage of spinal nerves in the sacral bone. These are the different joints in the pelvic bone. This joint is sacro-iliac joint, where sacrum and coccyx join together, that is sacro-coccygeal joint. Where two pubic bones join together, that is symphysiopubic joint or pubic symphysis. The ligament between sacrum and the iliac bone is called sacro-iliac ligament. So we have two sacro-iliac ligaments anteriorly and two posterior sacro-iliac ligaments. Here we have the sacro-coccygeal ligament. Between the two pubic bones, we have interpubic ligament. Between the sacrum bone and ischial spine, we have sacrospinous ligament. Between sacral bone and ischial tuberosity, we have sacrotuberous ligament. Before discussing the pelvic diameters, it's better to identify the landmarks of pelvis, which include first of all the sacral promontory, the sacral ala, the sacro-iliac joint, the iliopectineal line. This red mark line is iliopectineal line, iliopectineal eminence, superior ramus of the pubic bone, upper border of body of pubic bone, upper border of symphysis pubis. So all these structures make the boundary of pelvic inlet or the brim, and that boundary divides the pelvis into true pelvis and the false pelvis. This is whole pelvic brim. The part of pelvis above pelvic brim is called false pelvis. The part of pelvis below pelvic brim is called true pelvis. When we study the diameters of pelvis, we study pelvic inlet, pelvic cavity and outlet diameters. True conjugate is the distance from sacral promontory to the superior aspect of symphysis pubis, and that is 11 cm. In pelvic inlet, we have another anterior-posterior diameter called obstetric conjugate that extends from upper border of the sacral promontory to the upper and inner border of symphysis pubis. It is about 11 cm. The diameter which carries the highest obstetric significance is this obstetric conjugate. In the inlet, we have another anterior-posterior diameter called the diagonal conjugate that extends from the upper border of the sacral promontory to the lower border of the symphysis pubis. It is about 13 cm. One oblique diameter is taken from the sacro-iliac joint on one side to the iliopectineal eminence of the other side. It is 12 cm. The farthest points of the idiopectineal lines on both sides give the landmark of the transverse pelvic diameter. It is 13 cm at pelvic inlet. Now I will tell you the diameters of pelvic cavity. We don't have any bony landmark in the pelvic cavity and it is considered as the round. So all the three diameters like transverse, anterior, posterior and oblique diameters are of about 12 cm. In the pelvic outlet, the anterior-posterior diameter is taken from the sacro-coccygeal joint to the lower border of the symphysis pubis. It is about 13 cm in length. The oblique diameter is taken from the center of sacrospinous ligament to the center of obturator foramen. It is 12 cm. And these are the obturator foramen of the pelvis. The last one is the transverse diameter of pelvic outlet, that is measured from the ischial spine of the one side to the ischial spine of the other side, means it's the interischial diameter and it is about 11 cm. So that was all about gynaecoid pelvis. I hope you will learn from this video and will share it among your colleagues as well. Thank you so much. Allah Hafiz. Subscribe on Obs and Gynae. Allah Hafiz.